are the solutions always surgical, or is there stuff that people can do on a daily basis to kind of fix or help with their, let's say, sleep apnea or their breathing patterns?
Yeah, in simple terms, for say an adult patient who has diagnosed sleep apnea, let's talk about how we diagnose it first. You got to undergo some sort of sleep test. So there's the better quality ones are usually ones done in either a hospital or a sleep clinic. But there's some really high quality take home ones where you go to a clinic, and then you take it home yourself. You wire yourself up. There's like anywhere from 8 to 12 different cords. So you do an overnight test. And then from the data, a specialist sleep physician can interpret it and diagnose you whether or not you have sleep apnea or not, whether it's mild, moderate, severe, whether or not it's something else. Some people have insomnia, narcolepsy, airway resistance. So it's up to the sleep specialist to diagnose that.
Mhm.
So once we have a diagnosis of sleep apnea, that's when so for an adult, there's mainly three most common solutions. One is the CPAP. Have you heard of that one before?
Yeah,
The machine that makes you sound a bit like Darth Vader.
yeah,
Yeah. So I mean, if it's a patient with severe sleep apnea, that's still the gold standard. I still mainly try and you know convince patients to go down that route. If that's the case, then they'll be working with the sleep physician to find the best mask and the best fit and
mhm,
the best control for them because there's different rates of the airflow. However, they're obviously, if they're a young patient, however, they're usually not so keen on that. So the other options are yes, ear, nose, throat surgery if the issue is up here,
mhm.
and if the issues are more down here, then that's where I can do some help. Whether it's making a special appliance that brings the jaw forward to sleep to keep the airway open, or whether I go down the whole orthodontic route, where we can change the size, shape, and position of the jaws so to make the airway larger. So I don't know if I go
Yeah,
side on,
yeah,
and if my both my jaws come forward, the airway gets bigger as well in this region. So
right.
if the airway's bigger, they should be able to breathe better and sleep better.
Mhm. Wow. So dentistry is not just the teeth; it's the jaw, it's everything in the throat area. It's a lot more immersed than most people think it is.
Yeah, in a way, yes, but this stuff is not really taught at university level, so not many dentists can do these sort of treatments. But the good news is a lot of dentists, especially the young ones, whether it's on like social media and things they're reading online, they're becoming more aware of actually what an airway is and what maybe they should refer them off for further assessment or refer to someone who can actually treat these problems. So a
Mhm.
lot of my patients are actually referred, from even interstate, and on word of mouth as well.
Right.